So first, let's take a look at the Christopher and Dana Reeve Paralysis Act. One key provision that has been obstructed is this important piece of legislation dealing with paralysis. This legislation would support and enhance cooperation in paralysis research, rehabilitation, and quality of life programs for people with paralysis. It authorizes grants and research funding for clinical rehabilitation of paralysis. The bill has been languishing in the Senate calendar for well more than a year. And I repeat, passed the House with extremely broad bipartisan support. Dr. Coburn's office has indicated on several occasions that, okay, let's pass this. But we've heard that before. So I ask consent that the Help Committee be discharged from further consideration of H.R. 1727, the Christopher and Dana Reeve Paralysis Act, and the Senate proceed to its consideration, that the bill be read a third time passed, and motion reconsider be laid on the table. There be no intervening action or debate.
Is there objection?
Reserving the right to object.
Mr. President, now we'll turn to another important piece of legislation. This is what I mentioned earlier, the Lou Gehrig disease legislation. The bill would build upon, expand, and coordinate among pre-existing ALS registries, helping collect data essential to the study of this dread disease. Mr. President, the reason this is important, the average time from discovering a person has Lou Gehrig disease until you die is 16 months. Time is of the essence. The bill would create a federal advisory committee on the National ALS Registry and promote research access to ALS data. The bill passed the House 411 to 3 a year ago. Both House and Senate committees marked the bill up with bipartisan support. Senator Coburn said he wanted some changes made. So we've made those changes. Each change he told us he wanted, we've made. Then he asked for an additional change, and we made that. Now we've made extensive changes to the bill to accommodate concerns that Senator Coburn says he had with the bill. So I hope we can get it passed. So I ask consent that the Senate proceed to calendar number 518, the ALS Registry Act, that all after the enacting clause be stricken, that an amendment at the desk consisting of a compromise amendment based on the language of Subtitle A of Title I of S 3297 be inserted, that the amendment be considered and agreed to, and the bill as amended be read a third time passed, and the motions to reconsider be laid on the table. There be no intervening action or debate.
Is there objection?
Reserving the right to object.
I want to make a couple other efforts here. Melanie Blocker-Stokes Mothers Act. This bill would help provide support services to women suffering from postpartum depression and psychosis. It will also help educate mothers and their families about these conditions. It will support research into the causes, diagnosis, and treatments for postpartum depression. This is something that Senator Menendez and others feel extremely strongly about. This matter passed the House of Representatives 382 to 3. Senator Coburn repeatedly blocked the Senate Help Committee action on the Senate companion bill. So I ask consent that the Help Committee be discharged of S 1375, that the Senate immediately proceed to S 1375, that all after the enacting clause be stricken, that an amendment at the desk consisting of the text of Subtitle D of Title I, S 3297 be inserted in lieu thereof, that the amendment be considered, agreed to, the bill as amended be read a third time passed, and the motion to reconsider be laid on the table. There be no intervening action or debate.
Is there objection?
I object.
The next bill I want to seek consent on is the Stop Stroke Act. The Cochran-Kennedy Stop Stroke Act will help establish comprehensive systems of stroke care in healthcare settings and improve the education of first responders to ensure that patients presenting with signs or symptoms of a stroke will receive the highest quality care. The legislation was approved unanimously by the House in 2002. And in the last year, it's been approved by voice votes in the Senate and House committees and on the House floor. So I ask consent the Senate Help Committee be discharged of H.R. 477, that the Senate proceed to the bill, that the bill be read, third time passed, and motion reconsider be laid on the table. There be no intervening action or debate.
Objection.
Reserving the right to object.
Mr. President, another bill in the judiciary title of the package was the bill to reauthorize the Drug Endangered Kids Program. This bipartisan bill would authorize the Department of Justice to award $20 million per year. Remember, this authorizes it in grants designated to improve coordination among law enforcement, prosecutors, child protection services, social service agencies, and healthcare providers to help transition these drug-endangered children into safe residential environments. I ask unanimous consent that the Judiciary Committee be discharged from further consideration of H.R. 1199, and the Senate proceed to its consideration that the bill be read a third time passed, and the motion to reconsider be laid on the table. There be no intervening action or debate.
Is there objection?
I would object pending our review of the legislation.
One of the bills in this package has been languishing for well over a year, and I think it's shameful that that in fact is the case. It's Emmett Till Unsolved Civil Rights Crime Act. Emmett Till was a 14-year-old boy from Chicago visiting his relatives in Money, Mississippi, way back in 1955 when he was brutally mutilated and killed for whistling at a white woman. Remember, his courageous mother, wanting everyone to see the brutality of how her boy was killed, had an open casket. That open casket said it all. Killers in this case, like so many others during that time, were never punished for their violent, treacherous acts. However, by passing this Emmett Till Unsolved Civil Rights Crime Act, the Justice Department will have the tools necessary to investigate and prosecute violations of criminal civil rights statutes in which the alleged violation occurred before January 1st, 1970 and resulted in death. The bill has broad bipartisan support. I hope that we can pass the House passed bill. That way the bill would be signed by the President immediately. So I ask unanimous consent that the Senate proceed to count number 237, H.R. 923, that the bill be read a third time and passed, that the motion to reconsider be laid on the table, there be no intervening action or debate.
Is there objection?
Reserving the right to object.
These important pieces of legislation have been held up, are continuing to be held up, and that's unfortunate. Not a single piece of legislation today has been approved. That's the way it is with this arrangement, and I hope the Republicans accept what they've done. They have supported this. The Republicans have supported Senator Coburn's blocking bills having passed overwhelmingly in the House. They would pass overwhelmingly here, but the Republicans are supporting his procedural blockage of these bills.